Question 1. A licensed practical nurse, LPN, is caring for 4 clients. Which client should the LPN assess first? A. A client 3 days post-appendectomy reporting a pain level of 6/10. B. A client with pneumonia whose oxygen saturation just dropped from 94% to 88%. C. A client with stable heart failure requesting assistance to the bathroom. D. A client scheduled for discharge receiving final education on medication. Answer: B. A client with pneumonia whose oxygen saturation just dropped from 94% to 88%. The concept being tested here is prioritization, which is crucial in nursing. The key clue is the sudden drop in oxygen saturation for the client with pneumonia, indicating a potential respiratory emergency. This client's change in vital signs represents an unstable condition and a potential airway, breathing, or circulation (ABC) issue, making them the top priority for immediate assessment and intervention. For example, a sudden drop in oxygen could mean worsening lung function or an airway obstruction, requiring the nurse's immediate attention to prevent further compromise. Always remember to prioritize clients demonstrating acute changes in their condition, especially those affecting their ABCs, as these are life-threatening. Question 2. The LPN is preparing to administer medications through a client's nasogastric (NG) tube. What is the most important action for the LPN to take before administering the medications? A. Crush all medications finely and mix them with a small amount of water. B. Aspirate gastric contents to check for residual volume. C. Place the client in a supine position to prevent aspiration. D. Flush the NG tube with 30 milliliters of sterile water after medication administration. Answer: B. Aspirate gastric contents to check for residual volume. This question tests your understanding of safe medication administration via an NG tube. The most important action before administering medications is to check for gastric residual volume, as indicated by the keyword most important action. Aspirating gastric contents helps ensure the tube is correctly placed in the stomach and that the client is absorbing previous feedings or medications, preventing overfilling of the stomach, which could lead to vomiting and aspiration. For instance, if a high residual volume is found, administering more fluid could put the client at risk. Always remember to verify tube placement and assess gastric emptying before administering anything through an NG tube to prevent complications like aspiration. Question 3. A client with a new diagnosis of type 2 diabetes asks the LPN, "How will I know if my blood sugar is too low?" What is the best initial response by the LPN? A. You will need to check your blood sugar with a glucometer every time you feel unwell. B. Hypoglycemia symptoms include sweating, shakiness, confusion, and hunger. C. It's important to always carry a source of fast-acting sugar with you. D. Your doctor will explain all of this to you during your next appointment. Answer: B. Hypoglycemia symptoms include sweating, shakiness, confusion, and hunger. This question assesses the LPN's ability to provide client education, specifically on recognizing hypoglycemia. The keyword best initial response indicates the need to provide direct, essential information first. The most crucial initial information for a client with new diabetes is to teach them how to identify the signs and symptoms of hypoglycemia, low blood sugar, as this is a common and potentially dangerous complication. For example, if a client experiences shakiness and sweating, they can recognize these as signs of low blood sugar and take appropriate action. Empowering clients with this knowledge helps them manage their conditions safely and independently. Question 4. An LPN is assisting with the care plan for a client diagnosed with Clostridioides difficile, C. diff, infection. Which personal protective equipment, PPE, is most appropriate when entering this client's room? A. Surgical mask and gloves. B. Gown and gloves. C. N95 respirator and gown. D. Gown, gloves, and eye protection. Answer: B. Gown and gloves. This question focuses on infection control and proper use of personal protective equipment, PPE, for a client with C. diff. The key concept is that C. diff is transmitted through contact with contaminated surfaces or items, not through airborne droplets, making contact precautions essential. Therefore, the most appropriate PPE includes a gown to prevent contamination of clothing and gloves to prevent hand contamination. For instance, wearing a gown and gloves minimizes the spread of the bacteria when touching the client or their environment. Always remember that meticulous hand hygiene with soap and water, not alcohol-based sanitizer, is also critical after removing PPE when caring for C. diff clients because alcohol does not kill the spores. Question 5. The LPN is reinforcing discharge teaching for a client prescribed warfarin. Which statement by the client indicates a need for further teaching? A. I should avoid eating large amounts of green leafy vegetables. B. I will take my medication at the same time every day. C. I will report any unusual bleeding or bruising to my doctor immediately. D. It's okay to take over-the-counter ibuprofen for headaches. Answer: D. It's okay to take over-the-counter ibuprofen for headaches. This question tests the LPN's ability to evaluate client understanding of medication teaching, specifically regarding warfarin, an anticoagulant. The keyword indicates a need for further teaching, signals that you are looking for an incorrect statement. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, that can increase the risk of bleeding when taken with warfarin, making this statement unsafe. For example, combining warfarin with ibuprofen significantly raises the chance of stomach bleeding. Always emphasize that clients on anticoagulants should consult their healthcare provider before taking any over-the-counter medications, especially NSAIDs, due to the increased risk of bleeding. Question 6. A 75-year-old client with a history of falls is admitted to the hospital. Which action should the LPN prioritize to ensure client safety? A. Orient the client to the room and call light. B. Place a fall risk sign on the client's door. C. Ensure the client's bed is in the lowest position with side rails up. D. Encourage the client to wear non-slip socks. Answer: C. Ensure the client's bed is in the lowest position with side rails up. This question focuses on fall prevention in an elderly client with a history of falls, emphasizing the importance of proactive safety measures. The keyword prioritize directs you to the most effective immediate action. Ensuring the bed is in the lowest position reduces the distance if a fall occurs, and keeping side rails up, as appropriate per facility policy and client assessment, provides a barrier and a reminder, directly mitigating fall risk. For example, if the bed is high, a client trying to get out of bed might suffer a greater injury. Always remember that environmental modifications are crucial in preventing falls, and ensuring the bed is low is a primary physical safety measure. Question 7. An LPN is assisting with care for a client who is NPO for surgery. The client complains of dry mouth and asks for a drink of water. What is the most appropriate action for the LPN? A. Offer the client a small amount of ice chips. B. Provide oral care with a moist swab. C. Explain that drinking water is not allowed due to the surgery. D. Notify the registered nurse immediately. Answer: B. Provide oral care with a moist swab. This question assesses the LPN's understanding of NPO, nil per os, meaning nothing by mouth, status and appropriate comfort measures. The key phrase, most appropriate action, directs you to the best way to address the client's discomfort while adhering to NPO status. Providing oral care with a moist swab allows for comfort and relief of dry mouth without violating the NPO order, as no fluids are swallowed. For instance, a client who is NPO for surgery can become very uncomfortable with dry mouth, and oral care helps alleviate this symptom. Always remember that maintaining comfort while adhering to restrictions is a vital part of nursing care. Question 8. A client has a new prescription for a transdermal patch. Which instruction should the LPN reinforce with the client regarding patch application? A. Apply the patch to the same spot each time for consistency. B. Always apply the patch to a hairy area to ensure good adhesion. C. Remove the old patch before applying a new one. D. You can shower or swim with the patch on without issue. Answer: C. Remove the old patch before applying a new one. This question tests the LPN's knowledge of proper transdermal patch administration and client education. The concept is medication safety and avoiding overdose. The most critical instruction is to remove the old patch before applying a new one, as indicated by the need for clear, safe guidance. Leaving an old patch on while applying a new one can lead to an overdose of the medication because the client would be absorbing double the intended dose. For example, if a client forgot to remove the old fentanyl patch, they could experience severe respiratory depression. Always teach clients to remove the previous patch before applying a new one to prevent medication accumulation and toxicity. Question 9. An LPN is observing a newly hired unlicensed assistive personnel, UAP, assisting a client with ambulation. Which action by the UAP requires immediate intervention by the LPN? A. The UAP ensures the client is wearing non-slip socks. B. The UAP holds the client by their arm during ambulation. C. The UAP encourages the client to use a gait belt. D. The UAP ambulates the client to the bathroom with the bed alarm off. Answer: D. The UAP ambulates the client to the bathroom with the bed alarm off. This question assesses the LPN's supervisory role and clinical judgment regarding delegation and client safety. The keyword immediate intervention points to a critical safety error. Turning off a bed alarm for a client who is a fall risk before ambulation removes a crucial safety alert system, increasing the risk of an unassisted fall if the client attempts to get up alone later. For instance, if the UAP forgot to turn the alarm back on, and the client later tried to get out of bed unassisted, the alarm wouldn't sound to alert staff. Always ensure that safety devices like bed alarms are functional and appropriately used, especially for clients at risk for falls. Question 10. A client with chronic obstructive pulmonary disease, COPD, reports increased shortness of breath and a productive cough with thick, yellow sputum. What is the most appropriate initial action for the LPN to take? A. Administer a prescribed as-needed, PRN, bronchodilator. B. Encourage the client to increase fluid intake. C. Assess the client's oxygen saturation and respiratory rate. D. Notify the healthcare provider of the client's symptoms. Answer: C. Assess the client's oxygen saturation and respiratory rate. This question tests the LPN's ability to prioritize assessment in a client with a chronic respiratory condition experiencing worsening symptoms. The keyword most appropriate initial action guides you to the first step in the nursing process. Before intervening or notifying the provider, the LPN must gather more objective data to fully understand the client's current status and the severity of their respiratory distress. For example, knowing the exact oxygen saturation and respiratory rate helps determine the urgency and type of intervention needed. Always remember that assessment is the critical first step to guide further actions and ensure client safety. Question 11. An LPN is caring for a client who underwent a total knee arthroplasty yesterday. The client reports severe pain in the calf of the operative leg. On assessment, the LPN notes the calf is swollen, red, and warm to the touch. What is the most appropriate action for the LPN to take? A. Apply a warm compress to the client's calf. B. Administer a prescribed pain medication. C. Encourage the client to ambulate to promote circulation. D. Elevate the leg, restrict ambulation, and notify the registered nurse immediately. Answer: D. Elevate the leg, restrict ambulation, and notify the registered nurse immediately. This question tests the LPN's ability to recognize signs of a potential complication and take appropriate action. The symptoms described, severe calf pain, swelling, redness, and warmth, are classic indicators of a deep vein thrombosis, DVT, a serious and potentially life-threatening complication after surgery. Therefore, the most appropriate action is to elevate the leg and restrict ambulation to prevent dislodgement of a potential clot, and then immediately notify the registered nurse for further assessment and intervention. For example, encouraging ambulation could dislodge the clot, leading to a pulmonary embolism. Always remember to prioritize client safety and immediately report suspected DVT or other serious complications. Question 12. An LPN is reinforcing teaching about wound care for a client with a new colostomy. The client asks, "How often should I change my ostomy pouch?" What is the most appropriate response by the LPN? A. You should change it once a day, every morning. B. Change it when it is about 1/3 to 1/2 full. C. Only change it if it starts to leak or smell. D. You can keep it on for up to a week if it's not bothering you. Answer: B. Change it when it is about 1/3 to 1/2 full. This question assesses the LPN's knowledge of proper colostomy care and patient education. The keyword "most appropriate response" indicates the correct guideline for ostomy pouch management. Changing the pouch when it is 1/3 to 1/2 full prevents leakage and reduces the risk of skin irritation from excessive weight or content. For instance, waiting until the pouch is completely full could lead to unexpected leaks and skin breakdown around the stoma. Always teach clients that regular emptying and timely changes are key to maintaining skin integrity and preventing complications with an ostomy. Question 13. An LPN is assisting with the care of an older adult client who frequently gets confused, especially at night. Which intervention should the LPN include in the client's plan of care to promote safety and reduce confusion? A. Keep the room dimly lit at all times to promote rest. B. Restrict fluid intake after dinner to prevent nighttime toileting. C. Maintain a consistent daily routine and provide reorientation cues. D. Apply wrist restraints to prevent the client from wandering. Answer: C. Maintain a consistent daily routine and provide reorientation cues. This question focuses on managing confusion in older adults, particularly the concept of delirium or acute confusion. The most effective approach is to maintain a consistent daily routine and provide reorientation cues, which helps the client stay grounded and reduces environmental triggers for confusion. For example, keeping regular meal times and providing a clock or calendar can help orient the client to time and place. Always remember that predictable routines and environmental stability are crucial in minimizing confusion and promoting safety in clients experiencing cognitive changes. Question 14. A client reports severe anxiety and difficulty sleeping. The LPN reviews the client's medication administration record, MAR, and notes a standing order for lorazepam 0.5 mg PRN for anxiety. What is the most important action for the LPN to take before administering the medication? A. Ask the client about their usual sleep patterns. B. Assess the client's vital signs, especially respiratory rate. C. Document the client's current anxiety level using a numeric scale. D. Educate the client about potential side effects of lorazepam. Answer B. Assess the client's vital signs, especially respiratory rate. This question tests the LPN's understanding of pre-administration assessments for medications, particularly benzodiazepines like lorazepam. The keyword "most important action" points to the critical safety check. Lorazepam can cause central nervous system depression, including respiratory depression, so assessing vital signs, especially the respiratory rate, before administration is crucial to ensure client safety and determine a baseline. For instance, if the client's respiratory rate is already low, administering lorazepam could dangerously depress their breathing. Always remember that baseline vital signs are essential before administering medications that can affect respiratory or cardiac function. Question 15. The LPN is preparing to administer an intramuscular, IM, injection to an adult client. Which site is most appropriate for a deltoid injection? A. The ventrogluteal site, located on the hip. B. The vastus lateralis site, located on the thigh. C. 2 to 3 fingerbreadths below the acromion process. D. The dorsogluteal site, located on the buttock. Answer C. 2 to 3 fingerbreadths below the acromion process. This question assesses the LPN's knowledge of safe injection sites. The concept being tested is proper anatomical landmarks for IM injections, specifically the deltoid muscle. The deltoid site for IM injections is correctly located by placing 2 to 3 fingerbreadths below the acromion process, which is the bony prominence on the shoulder. For example, this landmark ensures the needle is injected into the muscle tissue and avoids nerves or blood vessels. Always ensure you accurately identify anatomical landmarks to prevent injury and ensure proper medication absorption when giving injections. Question 16. An LPN is reinforcing teaching to a client with a new prescription for an inhaled corticosteroid for asthma management. Which instruction is most important for the LPN to emphasize? A. Use this inhaler only when you feel short of breath. B. Rinse your mouth with water after each use. C. This medication will provide immediate relief for an asthma attack. D. You can stop using this medication once your symptoms improve. Answer B. Rinse your mouth with water after each use. This question focuses on critical client education for inhaled corticosteroids used in asthma. The keyword "most important" highlights a key action to prevent a common side effect. Rinsing the mouth with water after each use helps prevent oral thrush, candidiasis, a fungal infection that can occur due to the steroid suppressing the local immune response in the mouth. For instance, if a client doesn't rinse their mouth, they might develop white patches and soreness, making eating and drinking uncomfortable. Always emphasize rinsing the mouth after using inhaled corticosteroids to maintain good oral hygiene and prevent fungal infections. Question 17. The LPN is contributing to the care plan for a client with a pressure injury on the sacrum. Which intervention is most important for preventing further skin breakdown? A. Apply a thin layer of antibiotic ointment to the wound daily. B. Reposition the client at least every 2 hours. C. Provide high-protein dietary supplements. D. Cleanse the wound with hydrogen peroxide twice daily. Answer B. Reposition the client at least every 2 hours. This question addresses the core principle of pressure injury prevention and management. The concept is reducing pressure on vulnerable areas. The most important intervention for preventing further skin breakdown in a client with a pressure injury is frequent repositioning, specifically at least every 2 hours. This action redistributes pressure, improves circulation to the affected area, and prevents prolonged compression of capillaries, which is the primary cause of pressure injuries. For example, simply turning the client slightly can relieve pressure and promote healing. Always remember that offloading pressure is fundamental in the prevention and management of pressure injuries. Question 18. An LPN is observing a client eating their meal. The client suddenly grabs their throat and appears unable to speak. What is the LPN's initial action? A. Go to the client's other side and continue observing. B. Perform abdominal thrusts, Heimlich maneuver. C. Ask the client, "Are you choking?" D. Slap the client firmly on the back. Answer: B. Perform abdominal thrusts, Heimlich maneuver. This question tests the LPN's immediate response to a life-threatening emergency, choking. The phrase "appears unable to speak" is a critical clue indicating a severe airway obstruction. In such a situation, the client cannot cough or breathe effectively, making immediate abdominal thrusts, Heimlich maneuver, the most appropriate and life-saving intervention. For example, waiting to ask if they are choking or performing back slaps without assessing effectiveness could delay crucial intervention. Always remember to act quickly and decisively when a client shows signs of a complete airway obstruction, as minutes matter. Question 19. An LPN is preparing a client for discharge after a bout of viral gastroenteritis. The client asks what they should eat and drink. What is the most appropriate recommendation for the LPN to provide? A. You can go back to your regular diet immediately. B. Stick to clear liquids and then progress to bland foods like toast and crackers. C. Drink plenty of fruit juice to replace electrolytes. D. Avoid all food and drink for the next 24 hours. Answer: B. Stick to clear liquids and then progress to bland foods like toast and crackers. This question focuses on appropriate dietary teaching for a client recovering from acute gastroenteritis. The most appropriate recommendation is to start with clear liquids and gradually progress to bland, easily digestible foods. This approach helps the gastrointestinal tract recover without being overwhelmed, reducing the risk of nausea, vomiting, or diarrhea. For example, starting with broth, then introducing toast and crackers, allows the digestive system to gently resume normal function. Always remember that a gradual reintroduction of food, starting with bland options, is best for GI recovery after an acute illness. Question 20. A client with a urinary catheter complains of lower abdominal pain and says they feel like they need to urinate. The LPN notes that there has been no urine output in the past 2 hours. What is the LPN's initial action? A. Increase the client's fluid intake. B. Check the catheter tubing for kinks or obstructions. C. Administer a prescribed PRN pain medication. D. Notify the healthcare provider. Answer: B. Check the catheter tubing for kinks or obstructions. This question tests the LPN's problem-solving skills when encountering an issue with a urinary catheter. The keywords "no urine output" and "feels like they need to urinate" strongly suggest a catheter malfunction. The most appropriate initial action is to check for kinks or obstructions in the tubing, which are common and easily correctable causes of lack of drainage. For example, a simple kink in the tubing could be preventing urine from flowing into the bag, causing the client discomfort. Always remember to first troubleshoot mechanical issues with medical devices before escalating to other interventions or notifying the provider. Question 21. An LPN is reinforcing teaching to a new mother about umbilical cord care for her newborn. Which statement by the mother indicates correct understanding? A. I should clean the cord with alcohol every diaper change. B. I will keep the diaper folded below the cord stump. C. I should expect the cord to fall off within 1 to 2 weeks. D. I can give my baby a bath in a tub once the cord falls off. Answer: B. I will keep the diaper folded below the cord stump. This question assesses the LPN's knowledge of newborn care and client education. The concept is proper umbilical cord care. Keeping the diaper folded below the cord stump is correct practice because it allows air circulation to the stump and prevents urine contamination, both of which promote drying and reduce the risk of infection. For example, if the diaper covers the stump, it can remain moist and irritated. Always remember that keeping the cord dry and exposed to air is crucial for healing and preventing complications until it falls off naturally. Question 22. An LPN is reviewing the vital signs of a client admitted with dehydration, BP 90/60 mm of mercury, HR 110 bpm, RR 20 bpm, temp 98.6 degrees Fahrenheit 37 degrees Celsius. Which vital sign is most indicative of the client's fluid volume deficit? A. Blood pressure, BP 90/60 mm of mercury. B. Heart rate, HR 110 bpm. C. Respiratory rate, RR 20 bpm. D. Temperature, temp 98.6 degrees Fahrenheit 37 degrees Celsius. Answer, B. Heart rate, HR 110 bpm. This question tests the LPN's ability to interpret vital signs in the context of fluid balance. The concept is recognizing compensatory mechanisms for fluid volume deficit. A heart rate of 110 bpm, tachycardia, is the most indicative vital sign of dehydration because the body attempts to compensate for decreased circulating blood volume by increasing the heart rate to maintain cardiac output and tissue perfusion. For example, if there's less fluid in the vessels, the heart beats faster to try and pump the available fluid more quickly. Always remember that tachycardia is an early and common sign of fluid volume deficit as the body tries to maintain blood flow. Question 23. A client with a history of depression expresses feelings of hopelessness and states, "I just don't see the point anymore." What is the most important initial action for the LPN to take? A. Encourage the client to participate in group therapy sessions. B. Ask the client directly if they are having thoughts of harming themselves. C. Reassure the client that things will get better over time. D. Document the client's statement in the medical record. Answer, B. Ask the client directly if they are having thoughts of harming themselves. This question assesses the LPN's response to potential signs of suicidal ideation, which is a critical safety intervention in mental health nursing. The statement, "I just don't see the point anymore," is a significant cue for potential self-harm. The most important initial action is to directly assess for suicidal ideation by asking if they are having thoughts of harming themselves, as this is a direct safety concern. For instance, directly asking about suicidal thoughts does not plant the idea, rather, it opens a pathway for the client to express their feelings and ensures their safety. Always remember that direct questioning about self-harm is essential when a client expresses hopelessness or suicidal ideation. Question 24. An LPN is caring for a client who is receiving intravenous, 4, fluids. The LPN notes swelling, coolness, and pain at the 4 insertion site. What is the LPN's initial action? A. Elevate the affected extremity above the heart. B. Apply a warm compress to the site. C. Discontinue the 4 infusion immediately. D. Document the findings and notify the registered nurse. Answer, C. Discontinue the 4 infusion immediately. This question tests the LPN's ability to recognize signs of 4 infiltration and respond appropriately. The symptoms of swelling, coolness, and pain at the 4 site are classic signs of infiltration, where 4 fluid leaks into the surrounding tissue instead of flowing into the vein. The initial and most important action is to discontinue the 4 infusion immediately to prevent further fluid extravasation and tissue damage. For example, Continuing the infusion would only worsen the swelling and discomfort. Always remember to stop the infusion first if you suspect infiltration or phlebitis to protect the client's vein and surrounding tissue. Question 25. The LPN is preparing a client for discharge who received new crutches. Which statement by the client indicates proper understanding of crutch safety? A. I should lean on the crutch tops for support when walking. B. I will keep the crutches about 6 inches in front and to the side of my feet. C. I should wear loose-fitting shoes when using my crutches. D. I can adjust the crutches higher if my arms get tired. Answer: B. I will keep the crutches about 6 inches in front and to the side of my feet. This question assesses the LPN's understanding of crutch safety and patient education. The concept is proper crutch fit and use. Keeping the crutches about 6 inches in front and to the side of the feet provides a stable base of support and prevents the client from falling forward or backward. For example, if the crutches are too close, the client might lose balance. If too far, they might overreach. Always remember that proper positioning of assistive devices is crucial for balance and preventing falls.